Welcome back to Less Than 3%, where we talk about my journey to become a physician, medicine, healthcare, and really anything that relates to my journey as a black male pursuing medicine. And for this episode, we're going to get into a pretty pressing issue. I want to talk about something that has been discussed more and more over the past number of years that I think is pretty important to discuss and to learn more about. And that would be physician shortage, specifically what's going on in the United States in terms of potential shortages of physicians. And so this is an issue that maybe some people might not be too familiar with. And so I want to touch a couple of things, including what is happening in the United States with physician shortage, what exactly is going on, is there one, how serious is it, just how serious is that, and how can this potentially be improved? So there's a number of things I want to go into, and so first of all, I definitely want to allow us to take a look at what exactly the numbers are saying and why this is something that's being discussed. So I want to take a look at a press release, at a report from the AAMC that talks about the potential physician shortage that is going on. And so what this article mentions is that the United States could be seeing an estimated shortage of approximately 37,800 all the way to 124,000 physicians just by the year 2034, which is probably closer than we think. One of the key things that they mention is that demographics such as population growth, aging, can definitely be a key driver when it comes to this. So what we find is, number one, we have an aging patient population, but we also have an aging physician population, which is something I'm going to get into pretty soon. So the question really comes in now, what exactly is going on? And ultimately, just how serious is this? And one thing I want to take a look at is an aspect of the situation that I think makes it even more urgent. And that is the fact that there actually seems to be an extreme shortage of primary care physicians specifically. So I want to take a look at an article that was put together by St. George's University School of Medicine. It was published back in 2021, and they talk about this aspect of doctor shortages. So what they find with another statistic from the AAMC, or Association of American Medical Colleges, is that the US is expected to face a shortage of primary care physicians ranging from 21,400 all the way to 55,200 by 2033. And the reason I want to highlight primary care physicians is because there's a very special role that primary care plays in the healthcare system that other specialties don't necessarily play immediately. And what we find is ultimately, in some sense, primary care physicians, I would say, are the backbone of the healthcare system, in that ultimately the first people that patients are generally seeing is going to be primary care physicians. They're mainly the ones that are driving a patient's overall health, preventative care, really trying to keep them in the long term as healthy as they can. And without primary care, what you end up is having people who are taking more visits to the emergency room and not necessarily getting the best long-term care. This article definitely goes deeply into that, as one of the quotes they mention is that a shortage of primary care physicians means patients will start using emergency rooms and hospitals to meet their healthcare needs, which may jeopardize patient safety and significantly increase costs for the entire healthcare system, as unnecessary lab tests, imaging studies, and referrals may be ordered or repeated. So it definitely makes the healthcare system a lot less efficient overall. Now, what exactly does this mean then? What they go on to mention is that there really is a course of action that has to continue to take place. One thing they mention is the fact that there's more room for medical school graduates that needs to continue to expand. However, one thing is that just because people are graduating from medical school doesn't mean that they're necessarily becoming primary care physicians. The next thing that this brings me to is really just why. Why exactly are these physician shortages happening? Because we're talking about how prevalent this is and how much of an issue this is potentially causing in the future and in the long term, but why exactly is this happening? So I want to take a look at an article that was put together by Definitive Healthcare talking about 4 factors that lead to physician shortages. And I thought this really brought some great insight into it. And so I want to just list off a couple of things that I think are very important to consider in this conversation. Number 1, they mentioned shifts in physician and patient populations. And so as I touched on a little bit earlier on, there's an aging patient population and also there's an aging physician population. And so what I want to take a look at is the physician population for a second. Another statistic that they bring up in this article from the AAMC found that nearly 45% of doctors are older than age 55, and more than 40% of them will be 65 or older in the next 10 years. One thing that this article mentions is the fact that there's a wave of retirement that can definitely have a key impact on physicians that are coming into the healthcare system as well. One thing is that younger, more inexperienced healthcare professionals, as they're coming in, might not have as much veteran colleagues who can help guide them earlier on. And so that can lead to not as quality healthcare as they mentioned here in this article. The next thing I want to bring up is that most healthcare workers really prefer not to work in rural hospitals. And so that's another factor that has to be considered as well. When speaking statistically, as this article goes on to mention, is rural areas tend to have less physicians, nurses, specialists, and other healthcare workers, and the patient population tends to be older, less affluent, less well insured, a lot sicker, and ultimately just a lot more underserved. And so that can lead to not having as many physicians to help in these areas. Another factor to consider is that medical school and residency programs are limited. So one thing that this article mentioned that I thought was pretty interesting is that since 2002, medical schools have increased their enrollments by an entire 35%. Yet, the problem comes in when you consider acceptance rates of medical schools. So for instance, the average medical school in the US only has about a 7% acceptance rate. So although enrollment is increasing, the acceptance rate is still pretty low, so you're not necessarily getting a lot of physicians coming in very quickly. And the last factor, which I found to be very, very key and crucial, is that healthcare workers are burnt out. And this is definitely something I want to touch on more in another episode. But one thing that this article does mention is that the pandemic could have definitely played some role in this as well. Although this was already going on before the pandemic, after the pandemic, this definitely helped push a lot more healthcare providers to ultimately deciding they didn't want to necessarily work in the healthcare system anymore. The last thing I want to bring up is something that I found pretty interesting, and this was an article published on medicaleconomics.com by Lyle Berkowitz, who is an MD, and they bring in a perspective that I thought is something that's interesting to consider. And so what they mentioned is ultimately what doctor shortage. And the question that this article asked is there really a physician shortage that's the issue? Or is there something else underneath that has to be considered? And so basically what this article goes on to mention is that maybe what does need to change is bringing more physicians in, but rather the way that we do healthcare and practice healthcare. And ultimately what they suggest is moving less from maybe long waits in offices and clinics just to have short appointments in person, but rather shifting more towards virtualists and really being able to have care that doesn't necessitate being in person. And so I thought that's also another thing to consider, not just immediately the number of physicians, but again, just the quality of healthcare that's coming in. And so I just saw all these things tied together. Definitely helps give more insight into what exactly this issue is that's going on. And so in this episode, I just really wanted to allow us to get an idea of why exactly this issue is being talked about, what are some of the different aspects of it, what are some of the important things to consider, and even just with the perspective there that I heard from the last article, it's definitely easy to consider adding more people into the healthcare system to fix this issue, especially with an aging physician population. But I definitely think one thing we cannot ignore is really looking at how can we expand and improve healthcare in ways that aren't necessarily just increasing the number of physicians itself. I think looking at one of the things that one of the articles mentioned in terms of the pandemic definitely draws us to think about how we can better expand care, and definitely in terms of things like telehealth and being able to move a little bit more away from in-person and finding ways to make the healthcare system more efficient. So I think those all are things that we should definitely have in mind when it comes to tackling this issue in the long run. So I hope you enjoyed this episode. I hope you learned a lot from it, and let's see what we talk about in the next one.